Hello, I'm Danielle Boyce. I have a blog and video series on how to research your kid's medical condition like a pro because I am a patient advocate for children with epilepsy and intellectual disability and their caregivers, but I also have a master's in public health with a concentration in epidemiology, and I've worked to support researchers for the last 20 years, 13 of which I've spent at Johns Hopkins. So I feel that I can do my part by helping you to get up to speed on some really important resources that you should be using if you're a journalist, a patient advocate, a public health worker, or even an average citizen who wants to know what's true and what's false about coronavirus. Of course, the first place you should look for information is the Centers for Disease Control and Prevention, here, cdc.gov. They prominently feature coronavirus information. They have information for all different audiences. They have surveillance, meaning number of cases, information on testing, workplaces. This is a great source of information, and it's updated pretty frequently. The second source is World Health Organization. I went to their website this morning and I was blown away by everything they have on here. What I would do if I were looking for research on coronavirus, the first thing I would do is come here to their website and click Technical Guidance and Global Research. Okay, and then I would just click on Global Research. And here they have updates. They have a clinical trials registry platform, and you can view clinical trials specific to coronavirus and other clinical trials that are ongoing globally. And an emergency use listing procedure, information on that. But what I think many of you will be interested to see is this database of publications on coronavirus, which is pretty incredible. If you scroll down, look at all of these studies that they list, and you can search by different ways. They also provide a nice list of other resources on coronavirus, and if you see here, you just click on any one and it'll provide the abstract, and then the DOI, which if you click on that, it will bring you to the publisher's site for more information, and you can potentially download the full text article. The other two sites I want to show you, I'm going to cover separately in videos for my patient advocate, non-coronavirus audience, but I want to touch on them really quickly because clinicaltrials.gov will also allow you to look up studies that are ongoing in coronavirus, but also other conditions as well. And it's important that you can look these up, and especially if you're looking up previous studies on coronavirus, but not the coronavirus 19, for example. So if you look up, let's see, let's say they have kind of automatic drop-down menu. So let's just look here. Recruiting and not yet recruiting means studies that are in the process of recruiting, but not yet recruiting. It sounds confusing to some people, but that just means that they will eventually recruit, but they're just getting started up. They're very new. Okay, and click search, and you'll see many different studies and their locations. If you see a study in the United States that is enrolling, but it's not in your area, you can click on it and identify the researchers involved and contact them and see if you can either go to their site, if there's any funding for you to travel to their site, or for them to partner with your local site and somehow, if it's a matter of transmitting biological samples and so forth, sometimes they can be mailed through an intermediary like a local principal investigator. So it's always worth contacting them. Okay, this will tell you if they're recruiting or not. This will tell you the title of the study. These are the conditions. The interventions, that just means a drug or some other procedure that's going to be done in the study, and the locations. So let's see, here's a study that's recruiting. And this will show you an abstract, which is 300-word summary of what it is that they want to do, usually around 300 words. Study design, how many people are going to be involved, the dates, the sponsor of the study, the different arms involved, primary and secondary outcome measures, what they're trying to measure, how they're measuring the success, eligibility criteria. So inclusion and exclusion criteria. Inclusion criteria are factors that would make you a good candidate if you have these. Exclusion criteria are, even if you have these inclusion criteria, factors that would make you a bad candidate and they would exclude you from the study. These often have to do with biological factors, sometimes medication you're already taking. In this case, pregnant and lactating women, they don't want to include. Contacts and locations. This is the phone number and the email address of the person conducting the study, and more information on the study itself. If this study were completed and reported updates to PubMed, to clinicaltrials.gov, you would see under no results posted, it would show you the results and it would give you a list of adverse events, characteristics of people who were involved, and sometimes link you to, this is what I was referring to, PubMed, which is another website you need to know about. PubMed is how you look up peer-reviewed scientific literature. You want to look up peer-reviewed literature as much as possible, aside from these credible sources, CDC and World Health Organization. You don't want to trust information that comes in a meme. Researchers have said, anything that starts with that, but that does not have a citation listing who published it, the name of the researchers, and the journal where it was published. You need to do some footwork and find out if that information comes from a credible source. And this is how you do it. You go to PubMed and you put in, let's say, COVID-19, okay? And you search, and you can see all of the studies that have gone through peer review, which means a scientific study is written up in a publication and sent to a journal. An editor, who's usually an expert in that field, reviews it and determines whether or not it meets the editorial standards of that journal. And if so, the article is then sent to experts in the field, the peers, who review it and help to decide whether or not it needs work and will be sent back to be reworked before it can be published, if it has to be rejected, if there are other issues with it, or if it's accepted. This is a rigorous process, and conflicts of interest are also reviewed and published in the journal. It's very important that you don't just rely on these abstracts when you're speaking authoritatively, especially if you're publishing something in a newspaper, for example. You don't want to just rely on what you see in the snapshot, because there might be caveats, there might be limitations of the study that you would only be able to read if you read the full text. So while abstracts are useful to give you a taste, you must read the full text if you're going to be speaking authoritatively to patients in any capacity. Okay, so let's just click on this. I have a full article on how to use this, clinicaltrials.gov, and PubMed is under production, so that you can understand all the great tricks for using this. This is just to give you a snapshot for those of you who have never used it before. So you click on this, you can get all the authors' names and their affiliations or where they work. Okay. Lots of neat things you can do here, but what's great here is if The article is available for free in full text. You can click on it here and you can get to it. And here it is. And you can download it in PDF. That's all there is to it. So again, clinicaltrials.gov for studies that are enrolling or studies that have completed and have results posted. PubMed for studies that have been published through peer review. CDC for up-to-date public health information. World Health Organization, again for up-to-date public health information and latest information on research and clinical trials underway. One more thing I wanted to mention is if you click on this, download full database, you will be able to download in several different formats, including, I believe, EndNote, Mendeley, and I downloaded a CSV file, which is you can open up in Excel, basically a spreadsheet of all of these citations related to coronavirus. Very, very helpful. And then you can take those citations, and if you click on the DOI and you can't get to a full text article, take those citations and bring them into PubMed and see if you can access one that way. Thank you very much. Good luck and stay safe.